This is when COVID Delta variant will become worst, expert reveals. The COVID-19 Delta variant is becoming a much greater threat compared to other variants that hit cities. But has it delivered all already? An expert says that the real impact is yet to come, particularly in the US. This means people must brace themselves for the potential damage of this variant to households and the economy. So, if you're not vaccinated yet, consider getting one to receive protection against the Delta. According to the US CDC, the Delta variant was responsible for 31.1% of COVID cases from June 6 to 19. It was only at 10.1% in the week that ended on June 5 and 3.1% in the week that ended on May 22. This showed how fast the variant is spreading in the country. The bad news is the variant doesn't appear to be slowing down. In CNBC's Squawk Box, former FDA Commissioner Dr. Scott Gottlieb said that the likely peak of Delta is around the end of September. That's still a couple of months away but may change depending on how people act inside and outside of their homes. Gottlieb added that some areas should return restrictions until vaccination rates go up and new cases go down. He clarified that public health guidance must be addressed where the situation is going bad. So, no more national mandates of strict protocols but regionalized actions to prevent outbreaks from getting out of hand. If you are living in an area where cases are high, consider taking precautions with or without the mandate from the local government. What about those who are fully vaccinated? Should they strictly adhere to these precautions? Gottlieb advised that even with 2 doses, fully vaccinated people should remain vigilant and on the lookout. Breakthrough cases are not unheard of. Although they may not get hospitalized, they may risk others who aren't vaccinated yet. Thus, adopting precautions when in public or in the workspace is a good choice. After all, wearing a mask, washing hands frequently, and physical distancing can mean a lot to those we care about. In the journal Clinical Microbiology and Infection, Israeli researchers published that breakthrough cases were reported in those who received the Pfizer vaccine. Of 152 patients analyzed, 38 patients were deemed with poor outcomes. These patients were identified with high levels of SARS-CoV-2. They concluded that poor outcomes were likely due to multiple comorbidities and immunosuppressants. So such patients deserve guidance to maximize the protection given by COVID vaccines.